Hello, my name is Alicia. My husband Peter and I are from Mexico, and we've lived in the United States most of our life. We live in Southern California with our two young adult sons. Our youngest, Mark Anthony, is 19 years old and has cystic fibrosis.
I'm Jeannie Hanley, and I am from Los Angeles. I have cystic fibrosis, and I also have three siblings with cystic fibrosis, two of my three sisters and one of my five brothers.
My name is Marianela Gonzalez Fajardo, and I'm from San Jose, California, and two of my kids had CF. My daughter Maria was 15 when she passed away of cystic fibrosis. She did have a double lung transplant in 2012. My son Francisco is 18-year-old now and is still battling CF.
Hello, I'm Carlos Mila. I'm a pediatric pulmonary physician at Stanford University, and I'm also a cystic fibrosis specialist. I have worked in the CF field for more than 25 years now, believe it or not. And I'm the center director at Stanford, where I have both a clinical program as well as a research program.
I was diagnosed in my early 30s, as were my three siblings.
So my daughter was born November 19th, 2000. And at birth, I knew that she was sick. We just could not figure out what it was. At 4 months of age, she had a sweat test, which determined she had cystic fibrosis.
Mark Anthony was diagnosed with CF when he turned 6. The symptoms of cystic fibrosis were present from birth, but his pediatricians never thought to test him for CF.
Francisco was born May 15, 2003, and because he already had a sibling with CF, they decided at 4 months to test him as well, and he was also diagnosed with cystic fibrosis.
It wasn't until I became a doctor and was able to find resources and understand more about the disease that, and then of course, genetic testing became available, that I was able to get us all diagnosed.
So obviously the first question and where to start is with what we know as cystic fibrosis, how we define it. So first things first, I think we need to start by giving some definitions as to what is it that we know as cystic fibrosis. And first of all is a multisystemic process, which is simply jargon to say that this is a problem that affects the whole body and primarily characterized by defective ion transport across mucosal surfaces, meaning any wet surface in organs inside our body need to exchange fluid and salt, and that's where cystic fibrosis creates a problem. Now, the main defect is now well understood. This was discovered in 1989, where the gene responsible for CF was identified. And it was called cystic fibrosis transmembrane conductance regulator, which is a really long, complicated name to simply describe the gene as being responsible for creating a protein that is in charge of managing how fluid and electrolytes are transported across mucosa, with chloride being the main ion that is transported. We know very well that it's an inherited disorder, meaning it runs in families, and the inheritance pattern, as we call it, is autosomal recessive, which means that you need both parents to be carriers of a gene defect for CF for a baby affected by CF to be born. And now we know that the gene is located in chromosome 7.
Back then, we didn't have the benefit of newborn screening, and I don't know that we would have been diagnosed because in the Hispanic community, there are rarer mutations, and I don't know if our rare mutation would have been picked up by newborn screening.
We knew there was something there, but just didn't know what it was. Prior to his diagnosis, he would end up in the hospital once a year due to severe constipation. He also suffered frequent respiratory infections that doctors mistook for asthma. Yet during one of those hospitalizations, I shared with the doctor that Mark Anthony had a history of chronic digestive problems. He turned to me and mentioned they were going to test him for CF, though according to his understanding, that is not a common disease in the Hispanic or Latinx population. The doctor performed a sweat test that confirmed Mark Anthony had CF, followed up by a genetic test that informed us of the cystic fibrosis mutation present in Mark Anthony.
My sister, who was the sickest, she was a year older than me, she did get sweat chloride testing when she was 9 or 10, and it became back negative. And because hers was negative, none of the rest of us were tested. And it was assumed that CF was not a possibility, not only because we were older, and also because we were Hispanic.
The hardest thing for me when my daughter was diagnosed was having to pretty much translate everything over to her father because he was only Spanish speaking. And the resources at the time were not many. And if there was something, it was only in English. So I would have to read and translate at the same time. So he had an understanding of the diagnosis, what was the care that she was going to need, what were the medications, and just doctor appointments. It was very difficult in a sense at the time.
We know that particularly white people of Northern European accent, it can be somewhat common, and it has an incidence, at least in the United States, of somewhere around 1 in every 3,000 newborns will be affected by CF. Now, in the Hispanic Latino population, it's less common, but it's not really with a negligible frequency that we see. At least thanks to data from countries that do fairly active screening, and particularly here in California, we see that in the Hispanic Latino population, the incidence of CF is somewhere around 1 in 8,500 live births, which comes fairly close to what we see in other Latin American countries like Mexico, Argentina, Chile, where they have active screening programs and the incidence is fairly similar. So again, it's less common than in whites, but it's a fairly high incidence, taking into account that the birth rates are, particularly in some Latin American countries, much higher than in the US.
I did know about CF prior to my diagnosis because I went to medical school and they covered CF extensively then. But even then, I understood and learned that it was a Northern European disease of childhood. And so I didn't even think that we could have CF given that.
Prior to the diagnosis, I didn't know about CF.
Never heard of cystic fibrosis. I couldn't pronounce it. And I didn't know anybody when I got to Lucille Packard.
So prior to my being diagnosed, I had never met anyone else with cystic fibrosis. I had no patients with cystic fibrosis who were Hispanic. I didn't even know my own siblings for sure had cystic fibrosis.
However, upon learning more and talking to family members, I realized that 4 family members in Mexico died from CF, though at the time of their death, no one knew what it was that caused them to die.
Now, I then went on to start to treat patients who had CF later in my training, and even one was Black. And together I thought, they have the same symptoms I do. It's not just a Northern European ancestry. And it was the parallels that I then suspected even more that we had cystic fibrosis.
In the 2010s, we moved to an era where we now have universal neonatal screening for cystic fibrosis, which means that if you have the experience of having a young baby, there Typically, before leaving the nursery, there will be a heel prick performed and a few drops of blood will be collected on a paper card to be sent to the Department of Health. And here, those drops of blood will be tested for a number of conditions that we know are detectable in the neonatal period. Cystic fibrosis is now included on this test. And in the state of California, this has been a standard test since 2007. Now, the test is a screening test. It checks for chemicals that we know can be present when cystic fibrosis is present. But in California, that test is complemented with genetic screening, given that we know what the CF gene looks like and what a mutation can do to the gene. The test performed will look for these changes to more correctly identify if the possibility of cystic fibrosis is real or not. It tells us how likely it is that somebody could be affected by CF, and this will always require confirmatory testing. Overall, the test has been designed to not miss or to have a very low chance of missing a baby affected by CF, but at the same time, it has some chances of falsely identifying someone as possibly affected. That's why anybody that has a positive neonatal screening test has to be evaluated at a center and needs a sweat chloride test.
I believe that there are others experiencing a late diagnosis of CF due to a lack of information and/or a misperception by care providers that CF only impacts those of European descent. Fortunately, there's conclusive data demonstrating that is not the case, and we need to make sure every nurse and doctor knows about it.
I do believe that there are those in the Hispanic community who will be diagnosed late or who have not been diagnosed yet due to the misperception of CF being a disease of European descent and of childhood.
I do believe that there are some families, especially in the Latino community, that has been misdiagnosed or not even tested properly because they believe that CF is only a Caucasian disease, and it has affected the Latino community very, very hard.
Community physicians today still are not well aware of that CF does occur in every color, every ethnicity, and all around the world. The other thing is that newborn screening may not pick up the rarer mutations that we see in the Hispanic community and different ethnicities and people of color.
So with that being said, there are many people that can go into their adult years with a milder progression of the disease and not be correctly diagnosed until their adult years. So, and particularly this will apply to people that don't have pancreatic injury and that maintain a normal digestion. We know there are some mutations that are, require fairly sophisticated genetic testing to be able to pick them up and correctly identify the problem. In addition, some of these patients tend to have sweat chloride values that range in what we call a borderline or indeterminate range. And that also makes it difficult and confusing to be able to correctly identify CF as the underlying problem. So that's why it's important that any patient can really have access to the highest level of specialized care, since oftentimes we're seeing people getting lost on what we call a diagnostic journey, going through different medical providers and not being able to have access to the high level, the highest and adequate level of care, so that they can not only be correctly diagnosed, but also be started on the right treatments for their condition.
The advice I would give to someone who has symptoms of CF or a family who has a child with symptoms, I would suggest that they be insistent and persistent about testing, getting the proper testing, which includes sweat chloride testing, a skin test, and a blood draw of genetic testing.
Advice to a parent that their children are having symptoms would definitely be to get him properly tested and really push for a sweat test.
My advice to a family whose child has symptoms of CF but who has not yet been diagnosed is to ask the doctor to conduct a test for cystic fibrosis. Ask now, don't wait, because once you know whether your child has CF or not, you are better able to meet their needs.
I would suggest going to an academic center where there is a CF center. I would suggest contacting CF nonprofits like CFRI and to get more information and advocacy.
Don't be afraid that there is never too many questions that you can ask, because at the end of the day, you're going to be your son's advocate or daughter's advocate. If anything, you know your child more than anybody else. So do not be afraid, and you just keep on until they determine what is it that is wrong with him or her.
In the US, we have the situation where every state has its own mandates and its own regulations, plus its own standards as to how the test is conducted. So we do see some variation from state to state as to the ability of their neonatal screening to pick up every possible case. Now, knowing that CF occurs in almost every ethnic group with different incidents, we also know that there are many different combinations and possible mutations that can lead to cystic fibrosis. So not every test is really designed to pick up all possible cases. So we know that in some states, depending on how their test is designed, there's always going to be the possibility of missing some cases. And again, in some states, that possibility is lower as opposed to others where that possibility is going to be higher if certain ethnic groups or mutations are not represented on their testing. For this reason, we always remind primary care providers, and particularly pediatricians, about not forgetting about CF as a diagnostic possibility when they see a child that shows symptoms and signs and difficulties that are suspicious for CF. Because there's always going to be some possibility that the neonatal test could have missed cystic fibrosis as a possibility. Even more when you're talking about someone that was born in a state or a country where the neonatal test has higher chances of missing the possibility of CF.
It's very important to raise awareness about cystic fibrosis in the Hispanic and Latinx community. I don't want anyone to go through what I went through in order to get diagnosed or to deal with the symptoms without getting the proper treatment. My lung damage is irreversible. And despite the best medicines today, I still have to deal with frequent infections and CF itself, obviously. Unfortunately, my sister passed away at 42 years of age, only 8 years after she was diagnosed, because we had a whole life worth of not getting the proper medicines. With an early diagnosis, then irreversible damage can be prevented. And with good CF care for the Hispanic community, and really any community, anybody, it can prevent hospitalizations and surgeries, infections, and maintain good nutrition with the proper therapy, and ultimately a healthy life.
I think it's important to raise awareness about CF among members of the Latinx Hispanic community, because the more we know, the better we can provide our loved ones with the care and support they need in order to thrive.
Why I think it's important is, first of all, the language barrier definitely is one of the biggest things. Because of them not understanding, they will not ask questions. And a lot of the times, a lot of children will not be diagnosed or are undiagnosed because they're just going to assume they have a certain condition. So that is very, very important to properly educate them when it comes to CF.
CF is a rare disease in itself, and it's even rarer in the Hispanic community. So I think it's important to share this information with anyone who you think may be suffering from this constellation of symptoms.
So I'm gonna leave you with this: is the sooner you get your child diagnosed, will be a much better outcome, because he will start all therapy and any kind of care that he will need for his journey with cystic fibrosis.
The biggest thing was I was told, oh, I have underlying asthma, which is leading to a lot of the respiratory problems, but it didn't account for the digestive problems. The fact that my brother couldn't have children, you know, it didn't all add up until we got the diagnosis or suspected that CF. So I think if you know somebody or a family who's dealing with a child with this constellation of symptoms, please make them aware of this possibility, and that there are ways to get testing and an evaluation for cystic fibrosis and for the possibility of cystic fibrosis. It's so important to get the diagnosis as early as possible.